Hello, I'm Dr. Beverley Rowbotham, Chairman of Avant Mutual, and I'm here today to talk to you about what Avant is doing to ensure the safety of healthcare workers during the pandemic. Everybody recognises that the healthcare workers in Victoria and across Australia have done a magnificent job, but the cost of this effort is now becoming apparent. Avant welcomes the increased transparency of the Victorian Government. However, we are concerned that figures released last week show that over 3,000 healthcare workers have now contracted COVID-19. This is dismal news. Avant has been asking state and federal governments for safe workplaces since the beginning of the pandemic. Since our member survey in March, in which you told us overwhelmingly that you were worried about your access to PPE, you were worried about your own safety and that of your families. Avant has and will continue to argue that the best chance of a safe workplace rests on 4 actions. First, minimising exposure to the virus in healthcare facilities. The foundation of a safe workplace is testing, triage and isolation of patients suspected of COVID-19 infections. Second, substitute face-to-face consultations with telehealth wherever it is safe to do so. Third, good infection control. Training must be available for all healthcare workers, and we must be able to socially distance at work. Finally, all healthcare workers need access to the right PPE at the point of care. We need to be trained on how to don and doff safely. We need consistent guidelines on what PPE to wear and when. And lastly, we need access to fit testing. So what is Avant doing now? Firstly, PPE. We have asked the Acting Chief Medical Officer for consistent guidelines across the states and territories on the use of PPE and for the consistent application of those guidelines. Secondly, we have recognised that our members support telehealth and need it to continue beyond the 30th of September. We will advocate for this, and shortly you will receive a survey which will help us prepare this case. And lastly, we need to deal with the issue of workers' compensation. 86% of infections in Victorian healthcare workers were acquired at work. We are urging the ministers of the states and territories to put in place legislation that deems COVID-19 a workplace-acquired infection. Avant will do whatever we can to advocate for the safety of our members and of all healthcare workers. Please let us know the issues you face and how we can help, and we'll report back to you on our progress. And thank you for the tremendous work you're doing.